Okay, we go now to Sumter. Fred is on the line. Hi, Fred. How are you doing today?
I'm fine, thank you.
What's up?
I have a 17-year-old Jack Russell, and she's always had unbelievably good control until the last couple of months. And she is getting worse and worse about not being able to make it until she goes outside.
Okay. Yep.
And I don't think it's a physical problem because she, last week we were traveling and she spent about 3 days, most of the days, in a kennel, and no problem.
Right.
But any ideas on what I might be able to do or what?
Oh, yeah.
Yeah.
Oh, yeah.
Now, when you say she can't make it to go outside, is her bed ever wet, like when she gets up from laying down or anything like that?
No.
No?
No. Okay.
And does she actually squat and pee, as far as when she has to go?
Yes.
Okay.
Okay. Oh.
Because, when we have older, and especially older females
spayed.
incontinence is one of the things that you worry about. But, if it's getting harder as far as her making it, first thing you want to do is get the urine checked out because, at her age, certainly there could be, a urinary tract infection, there could be stones, there could be things like that. But also one of the things we worry about too is you worry about concentration of the urine and kidney function. Because if she's producing a lot more volume of urine, then a lot higher volume of urine and more urine, then she may have to go more frequently. And so that's why she has some accidents. And then the other thing that's frustrating and very frustrating is, as they get older, they can kind of start becoming like us. And that is, they say we start off as babies and we end up kind of like babies too. And that's, that dogs sometimes do, start losing their house training, either through confusion or other reasons. And so sometimes that can be an issue and when you put her in a kennel in a small confined space, then that may be something where she feels more comfortable, more confined, and that's her bed, and so she's not going to urinate on that, where when she's got roam of the house, then she can go, oh, well, I think a bathroom's over here. This is good. And so it can be more of a, psychological thing too. But the first thing always, especially at her age, is to make sure there's no underlying medical problem with the urine or any reason that she is.
Surprisingly enough, the problem is very seldom does she urinate. It's usually solid.
Okay, it's defecation.
Oh, it's defecation.
I'm sorry.
Okay.
We were going along the lines of what the most common is. Yeah. And so,
this morning she did both.
Okay. Yeah, and if it's
defecation,
then I would lean a whole lot more toward the psychological aspect and loss of house training and things like that.
Right.
Especially if the bowel movements are normal, if they're not hard, if they're not soft, if they're her normal bowel movements, then that's going to go a lot more along those lines of that she may be kind of losing that house training. And that is something you can talk to your family vet about. There are a few medications that may help with that. That are marketed. There's one called Anapril that's marketed for canine cognitive dysfunction, which you might well call old dog senility. And so there are some medications that could help with that. And so definitely, I would get her checked. But if the bowel movements are normal, then it probably is more psychological than anything else.
Yep.
You said Anapril?
Anapril is one of the brand names, yes, sir.
Okay. Well, the strange thing about it is she knows when she's done something she wasn't supposed to do, because you know how dogs are. She'll come to me and she'll give me that, I did something I wasn't supposed to do and I knew it, guilty look.
Yeah. And some of them, they do.
Sometimes they don't even do that, though.
Right, but she may not realize it when she's doing it.
Right.
She may realize it kind of after the fact.
Right.
And know that there's something wrong, but not when she's actually doing it. It may seem like the right thing to do at the time.
Right. Our pets are living longer, as are we.
Yes.
And as a result, we're seeing more of this, like you say, canine cognitive disorder. A lot of times a dog might get lost in a corner
Yeah, and that is the thing, when we look at that, there's a lot of things that that your family vet can talk to you about as far as clinical signs with that, but kind of getting lost in the corner, stuck in a corner, stuck in places where they know their way around. One thing is, if you've lived in the same house for a long time, the door opens on the same, the side of the door that opens, that they start going to the opposite side of the door. They're confused about which way they're going out. And then another big thing is pacing at night, that, where they used to sleep through the night, that they may get up and walk. You may hear them. And with smaller dogs, you may not hear it as much, but that they sometimes may pace or whine at night, that they don't sleep through the night anymore. And a lot of those things are things that can start, adding up with it.
Yep. Okay, Fred?
I think maybe it's the psychological problem you mentioned, because she sleeps through the night real well. And,
yes.
Okay.
And no problem like that. And she has always had exceptional control.
Yes, sir.
Right.
And the other thing, too, just to have your family vet check her over, because, there are some things, too, where if there's steps she's got to go outside, if there's, if she's got some pain, she may try to hold it as long as she can, because it hurts when she goes. Mm-hmm. And so then all of a sudden she's got to go. She's been trying to hold it because she was trying not to go because it hurt. But then once it gets to the point where she's got to go then. And so pain is another thing.
So
just a good physical exam.
Good physical exam
Yes,
could rule some of that out. Okay, Fred? Okay. Thank you.
Never checked out.
Okay, thank you.
Good luck, Fred. Yep. Bye-bye. Wow.